As we age, maintaining muscle strength, especially in our legs, is essential to staying active, independent, and free from the constraints of physical weakness. Leg strength directly impacts our ability to walk, balance, and perform everyday activities like climbing stairs, carrying groceries, or simply moving around the house. However, many seniors unknowingly take vitamins or supplements that may be undermining leg strength, joint health, and overall muscle recovery. In this video, we will explore 7 vitamins that seniors should stop taking, as they may contribute to muscle weakness, inflammation, and joint pain, all of which can destroy leg strength over time. While vitamins are generally essential for our health, not all supplements are created equal, and some may actually have negative effects on muscle health, particularly when taken in excess or when they are not properly balanced with other nutrients. The vitamins we will discuss are known to either disrupt muscle function, interfere with blood circulation, or contribute to inflammation, making it harder to maintain healthy muscles, particularly in the legs. In many cases, seniors may be taking these vitamins with the belief that they are helping their health, but in reality, they may be causing muscle weakness or even contributing to conditions like osteoporosis, arthritis, or muscle atrophy. At Nutrihubbliss, we aim to help seniors make informed decisions about their supplementation and provide guidance on which vitamins and nutrients actually support leg strength, muscle recovery, and overall health. Let's dive into the 7 vitamins that seniors should stop taking to preserve their muscle strength, particularly in their legs, and optimize their overall vitality. The worst vitamin number 1, high-dose vitamin A, can lead to muscle weakness and joint pain. Vitamin A is an essential nutrient that plays a vital role in maintaining vision, immune function, and skin health. However, for seniors, taking high doses of vitamin A in supplement form can be detrimental to leg strength, muscle function, and joint health. While vitamin A is necessary for good health, excessive amounts can lead to muscle weakness, joint pain, and even bone loss, all of which can interfere with mobility and the ability to perform everyday tasks. One of the main concerns with high-dose vitamin A is its ability to accumulate in the body. Unlike some vitamins that are excreted in the urine, vitamin A is a fat-soluble vitamin, which means that excess vitamin A can be stored in the body, particularly in the liver, for long periods of time. Over time, this buildup can lead to toxicity, which can have negative effects on muscle strength, bone health, and joint function. Seniors who consume too much vitamin A may experience bone pain, muscle weakness, and an increased risk of fractures due to the potential for bone thinning or osteoporosis. Excessive vitamin A can also increase inflammation in the body, which can worsen conditions like arthritis and muscle fatigue, particularly in the legs. Inflammation contributes to joint pain and muscle soreness, making it harder for seniors to maintain leg strength and stay active. For seniors who are already managing muscle recovery issues or joint discomfort, too much vitamin A can make these conditions worse. Let's consider the example of George "Gordy" Harris, a 73-year-old retired teacher from Denver, Colorado. Gordy had been taking a high-dose vitamin A supplement for years, thinking it would help boost his immune function. However, he began noticing that his legs felt weaker, he experienced joint pain, and his muscle recovery after walking was slower. After consulting with his doctor, Gordy learned that the high vitamin A levels in his system were likely contributing to his muscle weakness and joint discomfort. He reduced his vitamin A intake and switched to a balanced supplement regimen that included vitamin D and calcium to support muscle and bone health. Within a few weeks, Gordy noticed a significant improvement in his energy levels and muscle recovery. "I feel much better after stopping the high-dose vitamin A," Gordy says. "My joints and muscles feel less stiff, and I'm more active now." In summary, high-dose vitamin A can be harmful for seniors, as it may lead to muscle weakness, joint pain, and increased inflammation, all of which can negatively impact leg strength and overall vitality. Seniors should avoid high-dose vitamin A supplements and opt for a well-balanced diet or multivitamins that provide the right amount of vitamin A without the risks of toxicity. Next, we'll explore the second worst vitamin for seniors to stop taking, particularly for those looking to improve muscle function and joint health. The worst vitamin number 2, high-dose vitamin E, can lead to muscle weakness and increased inflammation. Vitamin E is a powerful antioxidant that plays a crucial role in protecting cells from oxidative stress and supporting immune health. However, for seniors, taking high doses of vitamin E can have negative consequences, particularly for muscle strength and joint health. While vitamin E is important for overall health, excessive intake, especially in supplement form, can lead to muscle weakness, increased inflammation, and reduced mobility in seniors. The main concern with high-dose vitamin E is its potential to increase inflammation in the body. While vitamin E has anti-inflammatory properties, too much vitamin E can have the opposite effect. High levels of vitamin E in the body can cause an imbalance in the body's natural inflammatory processes, which can lead to joint pain, muscle soreness, and slower recovery. For seniors, this increased inflammation can make it harder to maintain leg strength, recover from physical activity, and stay active. Additionally, high doses of vitamin E can interfere with blood clotting, leading to an increased risk of bleeding and bruising. Seniors, especially those on blood-thinning medications, should be cautious about vitamin E supplementation, as excessive amounts may increase the risk of complications such as hemorrhaging. For seniors already dealing with joint pain or muscle weakness, this can exacerbate symptoms and further hinder mobility. Consider the example of Harold "Harry" Simmons, a 75-year-old retired engineer from Dallas, Texas. Harry had been taking a high-dose vitamin E supplement to boost his immune system, but he began noticing that his muscles felt weak and his joints were more painful than usual. After consulting with his doctor, Harry learned that the high-dose vitamin E was likely contributing to his increased inflammation and muscle discomfort. Harry reduced his vitamin E intake and switched to a balanced multivitamin, which provided the right amount of vitamin E without the risks of toxicity. Within weeks, Harry felt a noticeable improvement in his muscle strength and his joint pain subsided. "I didn't realize how much the vitamin E was affecting me until I cut back," Harry says. "I feel better and have more energy now." In summary, high-dose vitamin E can be harmful to seniors as it may cause increased inflammation, muscle weakness, and joint pain, all of which can negatively affect leg strength and overall health. Seniors should avoid high-dose vitamin E supplements and instead opt for a balanced multivitamin or dietary sources of vitamin E to support muscle health and joint function. Next, we'll explore the third worst vitamin for seniors to stop taking, particularly for those looking to maintain muscle strength and stable energy levels. The worst vitamin number 3, high-dose vitamin D, can lead to muscle weakness and joint pain. Vitamin D is an essential nutrient that plays a crucial role in bone health, immune function, and muscle strength. It helps the body absorb calcium and supports bone density, which is particularly important for seniors. However, taking high doses of vitamin D in supplement form can actually be detrimental to muscle health and joint function. While vitamin D is vital for overall well-being, excessive intake can lead to toxic effects, muscle weakness, and increased calcium absorption, all of which can negatively impact leg strength and mobility. The main concern with high-dose vitamin D is vitamin D toxicity. When seniors take more than the recommended amount of vitamin D, their bodies may absorb too much calcium, leading to hypercalcemia, a condition where there is an abnormally high level of calcium in the blood. This excess calcium can contribute to muscle weakness, joint pain, and even kidney stones. For seniors, this can worsen muscle recovery, mobility issues, and make it harder to stay active and maintain muscle strength. Additionally, vitamin D toxicity can also contribute to calcification in the arteries, leading to heart problems and increased risk of cardiovascular disease. Seniors who are already managing high blood pressure or cardiovascular issues should be especially cautious with high-dose vitamin D supplementation, as it can exacerbate these conditions by increasing calcium deposits in the arteries and organs. Let's consider the example of Elizabeth Liz Thomas, a 72-year-old retired nurse from Phoenix, Arizona. Liz had been taking a high-dose vitamin D supplement to support her bone health. However, she started experiencing muscle weakness, joint pain, and a noticeable decline in mobility. After discussing her symptoms with her doctor, Liz learned that her vitamin D levels were too high, leading to calcium buildup in her body. Liz switched to a more balanced vitamin D regimen and began monitoring her calcium intake. Within weeks, she noticed a significant improvement in her muscle strength and joint pain. Cutting back on the vitamin D made all the difference, Liz says. I feel stronger and more mobile now. In summary, high-dose vitamin D can lead to vitamin D toxicity, causing muscle weakness, joint pain, and increased calcium absorption, which can negatively affect leg strength and overall muscle function. Seniors should avoid high-dose vitamin D supplements and stick to the recommended daily allowance, RDA, or get their vitamin D through safe sun exposure or food sources. Next, we'll explore the fourth worst vitamin for seniors to stop taking, particularly for those looking to improve muscle recovery and joint health. The worst vitamin number 4, high-dose vitamin C, can lead to digestive issues and muscle discomfort. Vitamin C is a vital nutrient that plays a significant role in immune function, collagen production, and wound healing. It is also an antioxidant that helps combat oxidative stress in the body. However, for seniors, high-dose vitamin C supplements can lead to unexpected side effects, particularly when it comes to muscle health and joint pain. While vitamin C is important for overall health, excessive intake can cause digestive issues, muscle discomfort, and even kidney stones. The primary concern with high-dose vitamin C is its digestive impact. When seniors take too much vitamin C, it can cause gastrointestinal distress, including stomach cramps, bloating, and diarrhea. This can make it difficult to maintain regular activity and muscle strength, as digestive discomfort can interfere with day-to-day routines and contribute to fatigue. For seniors who are already experiencing muscle weakness or joint pain, the additional stress from digestive issues can make it harder to recover after physical activity. Furthermore, high doses of vitamin C can lead to the formation of kidney stones. Vitamin C is metabolized in the body into oxalate, which, in excess, can bind with calcium and form kidney stones. This condition is particularly concerning for seniors, as kidney stones can cause painful urination, back pain, and lead to further muscle discomfort due to dehydration or urinary issues. The added risk of kidney stones can make it harder for seniors to stay active and avoid muscle fatigue. Let's consider the story of Frank Moore, a 70-year-old retired mechanic from Minneapolis, Minnesota. Frank had been taking high-dose vitamin C supplements to boost his immune system and prevent colds. However, he began experiencing digestive issues and felt muscle soreness and fatigue after walking. After discussing his symptoms with his doctor, Frank was advised to cut back on his vitamin C intake. He switched to a balanced daily dose and found relief from his stomach discomfort and muscle pain. I didn't realize how much the vitamin C was affecting me until I cut back, Frank says. Now I'm feeling much better and my energy is more stable. In summary, high-dose vitamin C can lead to digestive issues, muscle discomfort, and even kidney stones, which can negatively impact muscle strength and overall health. Seniors should avoid excessive vitamin C supplements and stick to the recommended daily allowance, RDA, or get vitamin C from food sources like citrus fruits, bell peppers, and broccoli. Next, we'll explore the fifth worst vitamin for seniors to stop taking, particularly for those looking to improve muscle function and joint health. The worst vitamin, number 5, high-dose vitamin B6, can lead to nerve damage and muscle weakness. Vitamin B6 is a crucial nutrient that supports brain function, immune health, and nervous system health. It helps in the production of serotonin, dopamine, and hemoglobin, which are essential for mood regulation, muscle function, and blood oxygenation. However, high doses of vitamin B6 can have a negative impact on muscle strength and nervous system function, especially in seniors. While vitamin B6 is beneficial in the right amounts, too much can lead to nerve damage, muscle weakness, and balance issues, all of which can significantly impact leg strength and overall mobility. The main issue with high-dose vitamin B6 is its potential to cause neuropathy, a condition that damages the nerves. When seniors consume excessive vitamin B6, it can result in nerve damage, leading to tingling or numbness in the hands and feet, muscle weakness, and even difficulty walking. The nerve damage caused by vitamin B6 toxicity can interfere with normal muscle function, making it harder for seniors to stay active, exercise, or perform everyday activities that require strong leg muscles. As muscle strength diminishes, it becomes increasingly difficult to maintain mobility and independence. Additionally, high levels of vitamin B6 can contribute to balance problems, increasing the risk of falls and injuries, particularly in older adults who already have concerns about bone health and joint stability. For seniors, maintaining good balance and muscle strength is crucial for preventing accidents and maintaining functional independence. Consider the case of James "Jim" Walker, a 71-year-old retired firefighter from Detroit, Michigan. Jim had been taking high-dose vitamin B6 supplements to help with energy levels and nerve health, but he started noticing muscle weakness and numbness in his fingers. After consulting with his healthcare provider, Jim learned that the high vitamin B6 levels in his system were likely causing nerve damage. Jim reduced his vitamin B6 intake and switched to a more balanced supplement regimen. He also added B6-rich foods like chicken, potatoes, and spinach to his diet. Over time, Jim found that his muscle strength improved and the numbness in his fingers decreased. "I had no idea how much the high dose of B6 was affecting my muscles and nerves," Jim says. "Now I feel stronger and more stable." In summary, high-dose vitamin B6 can lead to nerve damage, muscle weakness, and balance problems, which can negatively affect leg strength and overall mobility in seniors. Seniors should avoid excessive vitamin B6 supplements and ensure they are getting the proper amount through a balanced diet or multivitamin. Next, we'll explore the sixth worst vitamin for seniors to stop taking, particularly for those looking to improve muscle recovery and joint health. The worst vitamin, number 6, high-dose vitamin K, can affect blood clotting and muscle function. Vitamin K plays an essential role in blood clotting and maintaining bone health. It helps in the synthesis of proteins required for proper blood coagulation and supports the strength of bones by aiding calcium absorption. However, for seniors, taking high doses of vitamin K can have a negative impact on muscle strength, joint health, and overall mobility. While vitamin K is necessary for good health, excessive intake can cause blood clotting issues and may hinder muscle function in certain individuals. The primary concern with high-dose vitamin K is its effect on blood clotting. For seniors, especially those who are already on blood-thinning medications, such as warfarin, excessive vitamin K can interfere with the effectiveness of these medications. Vitamin K promotes the production of clotting factors in the liver, which can counteract the effects of blood thinners, increasing the risk of blood clots and strokes. Seniors taking blood thinners should be cautious with high-dose vitamin K supplements or foods high in vitamin K, as clotting issues can be life-threatening. Additionally, excessive vitamin K can affect muscle strength and joint health. For those with certain muscle conditions or joint pain, high doses of vitamin K can exacerbate inflammation and muscle fatigue. Inflammation is known to weaken muscles and reduce mobility, making it harder for seniors to maintain leg strength and remain active. When muscle recovery is slowed due to vitamin K imbalance, it hinders seniors from maintaining their independence and continuing daily physical activities. Consider the case of Arthur "Art" Bennett, a 68-year-old retired lawyer from Chicago, Illinois. Art had been taking high-dose vitamin K supplements to help with bone health, but he began noticing increased joint pain and muscle weakness. After consulting with his healthcare provider, Art was advised to reduce his vitamin K intake as it was interfering with his blood thinner medication and contributing to his muscle soreness. After adjusting his supplement regimen and cutting back on vitamin K-rich foods, Art experienced improved mobility, reduced joint pain, and better muscle function. "I didn't realize how much the high vitamin K was affecting me," Art says. "Now I'm much more active and feel less fatigued." In summary, high-dose vitamin K can lead to blood clotting issues, muscle weakness, and joint discomfort, which can negatively affect leg strength and overall mobility in seniors. Seniors should avoid excessive vitamin K supplements and ensure they are getting the proper amount through a balanced diet or multivitamin that provides adequate support for bone and blood health without the risk of clotting complications. Next, we'll explore the 7th worst vitamin for seniors to stop taking, especially for those looking to maintain muscle recovery and joint health. The worst vitamin number 7, high-dose vitamin B12, can lead to nerve damage and muscle weakness. Vitamin B12 is a vital nutrient that plays an essential role in red blood cell production, nerve health, and DNA synthesis. It helps maintain nerve function, supports energy levels, and is important for brain health. However, for seniors, taking high doses of vitamin B12 in supplement form can lead to nerve damage, muscle weakness, and joint discomfort, especially when taken in excess or without proper balance with other vitamins and nutrients. The main concern with high-dose vitamin B12 is its potential to cause nerve damage when consumed in excess. While vitamin B12 is generally considered safe, taking high doses for an extended period can overwhelm the body's natural processes and lead to numbness, tingling, and muscle weakness, particularly in the hands and feet. Seniors who consume excessive amounts of vitamin B12 may experience muscle soreness and reduced mobility, making it harder to stay active and maintain leg strength. Moreover, high-dose vitamin B12 can also lead to increased levels of certain proteins in the blood, which could interfere with muscle recovery and contribute to inflammation. Chronic inflammation has been linked to muscle loss, joint pain, and fatigue, all of which make it more difficult for seniors to maintain muscle strength and independence. Let's consider the example of Kathy Jameson, a 71-year-old retired nurse from Miami, Florida. Kathy had been taking high-dose vitamin B12 supplements to combat fatigue and muscle weakness, but she started noticing numbness in her hands and feet, as well as increased muscle soreness. After consulting with her healthcare provider, Kathy was advised to reduce her vitamin B12 intake and opt for a balanced multivitamin with a moderate dose of vitamin B12. Within a few weeks, Kathy noticed a significant reduction in her muscle pain and numbness, and she felt more energized. "Cutting back on the vitamin B12 really helped me feel better and more mobile," Kathy says. "Now I can enjoy my walks again without the discomfort." In summary, high-dose vitamin B12 can lead to nerve damage, muscle weakness, and increased inflammation, which can negatively impact leg strength and overall muscle function. Seniors should avoid excessive vitamin B12 supplements and opt for moderate doses in multivitamins or food sources to support nerve health, muscle recovery, and overall vitality. As we age, maintaining leg strength and muscle health is essential for preserving mobility, independence, and overall well-being. In this video, we have discussed 7 vitamins that seniors should stop taking as they can contribute to muscle weakness, joint pain, and increased inflammation, all of which can undermine your leg strength and mobility. While vitamins are important for overall health, it's crucial to be mindful of the dosage and the potential risks associated with high levels of certain nutrients. From high-dose vitamin A to vitamin B12, we've highlighted how excessive supplementation can lead to toxic effects, such as nerve damage, muscle fatigue, and blood sugar imbalances, which make it harder for seniors to stay active and maintain leg strength. By avoiding these harmful vitamins, seniors can reduce their risk of experiencing muscle weakness and improve their overall vitality. Instead of taking high doses of these vitamins, seniors should focus on getting balanced nutrition from whole foods and moderate supplementation when necessary. A well-rounded diet that includes vitamins, minerals, and nutrients in the right proportions will provide the support needed to maintain muscle function, joint health, and overall strength. At Nutrihubbliss, we encourage seniors to be proactive about their health and make informed decisions about vitamin supplementation. By choosing the right vitamins and avoiding oversupplementation, you can help ensure that your leg strength, muscle health, and overall vitality remain strong for years to come. If you found this video helpful, please share it with others and leave a comment about your vitamin regimen. Don't forget to like, share, and subscribe to Nutrihubbliss for more expert tips on healthy aging, muscle recovery, and overall wellness. Together, let's continue making smart decisions that help us all live stronger, healthier lives.